Disorder of stomach. MBBS Guide PLZ. Like and subscribe our channel. Gastritis. Gastritis. It is inflammation of gastric mucosa, leading to mucosal atrophy, and intestinal metaplasia, in the absence of erosions. Types of gastritis. Type of gastritis. It is an autoimmune gastritis that involves body and fundus. Due to formation of antibody against parietal cells, it is associated with formation of cancer. Types of gastritis. Type B gastritis. It is most common type of chronic gastritis. It involves the antrum and pylorus. It is caused by H. pylori. Acute gastritis comes on suddenly and lasts for short period of time. Chronic gastritis means symptoms persist for months or years. Granulomatous gastritis, commonly seen in Crohn's disease and tuberculosis. AIDS gastritis. It is secondary to infectious with Cryptosporidium. Eosinophilic gastritis. It is allergic basics. Erosive gastritis is caused by NSAID and alcohol. Erosive is more severe form. It wear away the stomach lining, leading to formation of sores and erosions. If left untreated, can penetrate deeper into stomach, form painful ulcers. Reflux gastritis. It is most common caused after surgery. Stress gastritis. It is most commonly caused serious illness or injury. Symptoms of gastritis may include heaviness, pain, heartburn, nausea and vomiting. Diagram shows healthy stomach and stomach with gastritis. Peptic ulcer. Peptic ulcer. It is formation of ulcer in any portion of GIT, caused by the action of gastric secretion, and impaired mucosal defense. Locations. Duodenum most commonly first portion. Stomach lesser curvature of stomach. Gastroesophageal junction. Meckel diverticulum. Ulcer occur at a junction between different types of epithelium. Causes. H. pylori most common. Chronic use of NSAIDs and aspirin. Steroid. Smoking. Diagnosis and investigations. Gastroendoscopy is investigation of choice. H. pylori testing. ELISA serology test best initial. Urea breath test. Rapid urease test. Endoscopic biopsy is most accurate test. Treatment of gastric ulcer. Cessation of tobacco. H2 receptor antagonist. Proton pump inhibitors. H. pylori eradication therapy. It is the mainstay of treatment for peptic ulcer. Triple therapy for 14 days. PPI plus 2 antibiotics. Metronidazole clarithromycin. Cordapple therapy gold standard for 14 days PPI. Plus bismuth plus 2 antibiotics. Metarozine plus 2 antibiotics. Anti-secretory agents. Sucralfate. Antacids. Prostaglandins. H2 blockers. PPI. Bismuth. Difference between gastric and duodenal ulcer. Gastric ulcer occur in stomach. Duodenum ulcer occur in duodenum. In gastric ulcer, pain occur after meal. Epigastric pain 5 to 6 hours after meal. Gastric ulcer causes hematemesis and melana. Duodenal can cause melana and hematochezia. In gastric ulcer, heartburn, chest discomfort commonly seen. Less common in duodenal ulcer. Gastric ulcer cause gastric carcinoma mostly in elderly. Pain may awake the patient in the night. Stomach cancer. Definition. It is one of the commonest tumor of GIT. Men are more affected than women. Age above 50 years. Risk factor of stomach cancer. Long-term alcoholism and smoking. Bad eating habit. Family history of disease. Patient with atrophic gastritis. Patient with large gastric ulcer. Residual stomach patient. Investigation. Gastroscopy biopsy. Barium meal shows filling defect. Or an irregular ulcer with rolled edges. Cordon ultrasound. Quart sac shows gastric wall thickness. Ultrasound demonstrates mass and wall thickening. Symptoms of gastric cancer. If cancer invade diaphragm, it causes HICUs. Infiltration. Compliance. Early satiety, weight loss. Ulceration, bleeding. Early perineural invasion causes pain. Stages of stomach cancer. Stage 0 invade mucosa. Stage 1 invade submucosa. Stage 2 and Stage 3 invade mucosal. Stage 4 invades serosa. Spread direct. Muscularis serosa. Lymphatic. Regional extensive left supraclavicular node. Blood. Via portal vein. Lung and bone. Transperitoneal. Indicates incurability. Anywhere into peritoneal cavity. Can give rise to ascites. Krunkberg tumor. Sister Joseph's nodules. Management. Surgical treatment is a curative treatment for early gastric cancer. but most of the cases found inoperable at the time of surgery. Palliative measures are usually performed to prevent obstruction. Carcinoma at cardia may require endoscopic dilatation, laser therapy or insertion of metallic stent to allow swallowing. Improved nutrition by parenteral or enteral feeding. Fluid electrolyte imbalance and anemia should be corrected. Upper and lower GI bleeding. Upper gastrointestinal bleeding. Bleeding from the site posterior to the ligamentum teres. Hematemesis is the cardinal sign. Some may present with melena. Lower gastrointestinal bleeding. Bleeding from the distal to the ligamentum teres. Hedechesia is the usual presentation. Hematemesis. Vomiting of fresh or old blood. Proximal to the teres ligament. Bright red blood, significant bleeding. Melena. Passage of black, foul-smelling stool. Usually upper source may be right colon. Hematochesia. Passage of bright red blood from rectum. If brisk and significant, upper GI source. Thank you so much. Must like and subscribe our channel to learn in the easiest way.